Hello viewers, my name is Dr. Fredrick Kairetheia, gynecologist at Calgary Medical Center, located at KME Center in Upper Hill. So this is a one-stop comprehensive medical center which has got both inpatient, rather outpatient and theater facilities. We have laboratory and diagnostic services. So our clients range from general clients to specialized clients with conditions in the reproductive area. Once in a while, we also see clients with surgical conditions who require surgeries. Currently, you're watching Tililindo program on CAS TV. Thank you very much for the opportunity. So the word cancer generally means a state in the body where the cells are dividing at a very rapid rate, causing accumulation of tissues. And this rapid multiplication of the cells does not obey the natural multiplication patterns. So as a consequence, you have certain cells in the body which eventually form a large swelling, and that swelling presents with other related complications. So to be specific, cervical cancer is a situation where the cells that line the cervix, which is the lower part of the uterus, tend to grow rapidly and multiply very fast in a cancerous formation to cause initially local disease, which later with time will spread to the pelvis and other distant organs. It's good to admit that we do not have like on-point statistics about the prevalence, partly because of underreporting and lack of reporting. Because we are coming from an area where anything reproductive tract, such as the cervix, the vagina, the uterus, are treated as a taboo. But from the data that we have, it is estimated that more than 2,000 women will die from complications of cancer within a year. And just to put that in perspective, you can imagine those are like how many aeroplanes carrying women which plunge in the sea and people die. Another notice is that women who die from cervical cancer are what we call in the reproductive bracket, both in terms of sexual reproductive and economic reproductive. So when you lose this cohort of women from cervical cancer, then the economy suffers, the family unit suffers, and there are quite other long-term consequences. In terms of patients who are seeking treatment for long-term complications, women on dialysis, women who are occupying beds in hospices and in hospitals, then cervical cancer also accounts for a bigger proportion of such. The last thing to mention is you asked why it is prevalent. The cervical cancer has been strongly associated with infection by a virus called human papillomavirus, HPV, which is largely sexually transmitted, and of course it is also associated with the women in the lower socioeconomic status. So there are around 2 or 3 things which account for this high prevalence. One, the rampant infection and circulation of women, circulation of this oncogenic strain of HPV in the population. Number 2, women who relatively have low immune system, like ladies who are immunosuppressed with HIV, chronic diseases, malnutrition. They also tend to have a higher prevalence. And the third thing is general lack of awareness and lack of screening. Because if the natural history of this disease is that it will start as a small lesion, which eventually will progress and start invading local tissues. So it is known that if these women are screened and the disease is found earlier, then it is possible to intervene and treat the disease before it reaches the advanced stages. We're in a very patriarchal state where women are a bit disadvantaged in terms of raising awareness about issues that affect them. Number two, you find there's a lot of religious connotations when you're talking about sex and sexuality. And I said earlier that it is a disease of sexual reproductive organ called the cervix. So people will treat that. In fact, people call that region private part. So you can imagine when an area is called private part, people will not come out openly and discuss. Even when they are sick, they would show up very late in the day. So those are the three things I can quickly isolate. But also in certain setups, we've seen the disease has not been highlighted and given the relevance that it is supposed to be. And that's why we really applaud this concept of raising awareness during this month of January. Because as it is, no woman should die from a preventable disease like cervical cancer. There is a very low penetration of screening services to the masses. And not only in the rural areas, actually even in bigger cities like Nairobi and other bigger towns, because of the stigma that is associated with the disease. And of course, also there are many myths around the aspect of cervical cancer. So that one has been cited to fuel a lot of spread, and in many cases, late presentation with the disease. Because how cancer progresses, you will have the initial changes in the cells, and that's we call precancerous state or premalignant state. And then when the body does not clear that, it will change to early stages, ranging from stage 0, which is a local disease, to stage 4, where the disease has spread to the distant organs in the system. So you find people will ordinarily present when the disease has spread to the bones, to the pelvis, sometimes to the lungs, and people will show up to the doctor because they're having difficulties in breathing, or they'll show up when they're having very low levels of blood because of constant bleeding. So that inevitably will rob up the opportunity of taking care of this disease early. Just to the listeners is that it's good to know that this disease, if it is picked early, then it can be completely cured, because it's one of the disease which takes up to 10 years to spread. It's not very aggressive, but if somebody shows up late, then nothing much can be done. The universal recommendation is to vaccinate both boys and girls, but there's limitation in terms of access, in terms of funding, in terms of acceptability, and other factors. So when we say that the HPV is spread sexually, of course, we're insinuating without saying that it is being carried by the male species of people, because they are the ones who will play a role. You asked a question about why HPV is relevant. So HPV has been shown to integrate itself into the DNA of certain cells of the reproductive system to cause two consequences. And one of the consequences is that people will present with warts. And the warts are large growths in the private area which are not cancerous, which means they are localized, they don't spread. Then there are about 4 or 6 substrains of this virus, which actually integrate itself in the DNA of the cervical cells and interfere with that organized and controlled multiplication of cells. And that's what I started by saying. You have erratic, abrupt, and disorderly multiplication of cells to cause the phenomenon of cancer. Now, these strains which cause that, they are called oncogenic HPV strains, and it is for those strains where the vaccine has been developed. So like any other condition that we have, may it be measles, polio, or other conditions which are immunizable, the idea is to stimulate your body to produce antibodies or immunity, so that in case you encounter a natural infection in the form of HPV, then your body is able to fight to fight and mitigate the effect of this virus. The prevalence of HPV infection, depending on the society where you are, because we've said it is largely linked to the sexual activity, the prevalence may range up to in the excess of 90%. But it is not everyone who gets HPV infection who develops the cancer, because the body is able to clear this infection without any problem. There are cells which are actively roaming around and looking for these precancerous changes, and then they eliminate those cells. And that's why we said persons who lack that capability in terms of immunity then will tend to be more at risk of developing cancer in the long run. Yeah. So that is the essence of the vaccine. Good to note that everyone can benefit from the vaccine, but there are things which are possible in terms of programming. There are other things which are not possible. The reason why we talked about the 10-year-old girls is because we say they are prepubertal. So it is assumed they are given the vaccine to start forming antibodies before they hit what is called sexual debut, or before they start being sexually active. But for younger ladies, older ladies, they can also benefit from the vaccine, only that before the vaccine is administered, then they must be screened for infection with HPV. So they undergo HPV DNA testing, and if they are found to be naive, meaning they have never had an encounter with this virus, then they are candidates for vaccination, because it is assumed that they do not have any immunity. If you find you already have had an infection, then you are not qualified. Again, so that not to confuse viewers, there's a school of thought that even if you've had, then you can have a booster in form of an immunization or a vaccine, or it is assumed probably you had an infection but not with that specific oncogenic strain of the HPV virus. Yeah, but remember I told you when programs are rolled out, you look at what is easy to implement, and that is why it becomes almost impossible to vaccinate every other woman, because ideally, if resources were not limited, then we would be able to administer vaccine to all the women in the reproductive age category. Yeah. But we are limited. I already said about 99% are linked with prior infection with HPV. So we look at what are the predisposing factors to that, and one of them is having multiple sexual partners, women who have had very early debut, which means they have had early contact with the potential infection. So starting sex early, it's a risk factor. Women in the low socioeconomic status, actually in some quarters, cervical cancer is termed as the disease of the poor. because of these myriad of things that I've been discussing. The other factor is anything that lowers immunity. Women who are diabetic, women who are HIV positive, women who are on drug to suppress immunity after kidney transplant, women who are malnourished, women who have other connective tissue diseases which lower immunity, and women who have been on treatment with steroids, because steroids also lower immunity, women who have undergone chemotherapy for another reason can actually develop cancer of the cervix, and women who have had radiotherapy, because radiotherapy and chemotherapy can destroy the immunity and therefore leave these women vulnerable. Yes, there are specific cells of the immune system called the natural killer cells, which actually will rove around the body looking for these abnormal cells, and then they kind of destroy them. And that makes sense that when that particular bit of the immunity, the natural immunity, is broken, then the person is left vulnerable and they can get other conditions, what we call opportunistic conditions. I think one of the other things that we find repeating itself in almost all the cancers is excessive consumption of alcohol, which is thought to have an effect on the immunity, and smoking. Smoking as a risk factor, because smoke in itself contains certain carcinogens. So when it comes and compounds that, it's an issue. The other lifestyle factor, of course, sedentary life. Yeah, because there's a sedentary means life which you are not doing any activity, any exercise, because it is a known fact that exercises tend to improve immunity in one way or another. So women who are sedentary, women who are excessive smokers or take a lot of alcohol may tend to have an increased risk factor for that. I will not dwell on the risk factors because those are isolated. Remember, we said there are other logistical and operational factors which actually cause a lot of problem in the rural areas. And one of them is lack of screening, because it's a serious taboo to discuss cancer alone in the rural areas. I remember when I was in school, we would, because I trained in a university in Eldoret, Moi University, and the surrounding communities, we could go there and talk to people about screening, but still they could not take up the screening because they felt it is so intrusive to go and open your legs and get checked. Yeah, and sometimes they want to go, but their husbands or next of kin will not allow them because they think this procedure itself is very intrusive. Secondly, there is excessive fear of the word cancer. Yeah, so we used to tell them whether it's there and picked early, at least there's a chance it can be treated. If it's there and is not picked, it's just a matter of time before you show up with those late stage complications I talked about. So those are the two main issues of women in the rural area. The third one, which is contentious, is sharing of sexual partners. And sometimes we say women who do that, sometimes we encourage, if they can't, we encourage them to use protection so that they minimize that exchange of these carcinogenic strains of HPV.